Good evening, everybody. My name is Kim Nicholson, and this is a presentation by experts who specialize in the subject of pain management. Chronic pain is currently a very hot topic, with drug abuse at an all-time high. Casual sales of prescription drugs, either by those who are prescribed them or those who come by them through questionable means, in addition to new legislation that requires continual screening of pain management patients, is causing concern for those who legitimately require pain relief and those who prescribe it. Patients are reluctant to seek treatment for fear of the stigma associated with opioid and narcotic abuse. They're afraid that drugs will not control their pain, and they're also concerned about the lack of effective alternatives to drug therapy. Practitioners worry about addiction too. They are also concerned that funding by pharmaceutical companies only serves to the benefit of those companies. It doesn't help with the lack of education for patients and clinicians. And their concern is about the overdose figures, when the lack of education prevents people from taking their medication appropriately. My questions for our two experts are: do drug-free alternatives help with chronic pain? And what are the consequences of failure to provide relief from chronic pain? Stephen Morley is a professor of clinical psychology at the Leeds Institute of Health Sciences in the UK. His 30-plus year career has been focused on alternative therapy for chronic pain. He uses cognitive behavioral therapy, avoidance contingencies, and mindful responses to active pain, all of which are highlighted in his article, New Developments in the Psychological Management of Chronic Pain. Professor Morley maintains that the evidence speaks for itself. Cognitive behavioral therapy can teach those who suffer with chronic pain to control pain levels by avoiding situations that cause pain to worsen. These might be certain movements, skeletal stresses, and overextension, to name a few. Using mindful distraction techniques when actively in pain, which would include deep breathing exercises, visualization, memorized recital, and self-hypnosis, patients can manage their pain independently. Professor Morley would point to his success in assisting chronic pain during his 30 years of research and answer my first question in the affirmative. Yes, drug-free alternatives do help with chronic pain. Dr. Lynn Webster has been a practitioner for almost 4 decades, and according to some is considered to be a world-renowned pain management guru. In his article, A Responsible Way to Treat Patients in Pain, Dr. Webster discusses the sad cases of medication overdose, where accidental death occurs when a patient is uneducated about the correct way to use pain medication. He also discusses the unrealistic expectations of patients who believe that pain control equals pain eradication, taking more and more medication than what is prescribed to become pain-free. Dr. Webster dispels the commonly held belief that practitioners hand out prescriptions without adequately assessing their need, and points to the assessment tool that he developed to help clinicians do just that. He does, however, advocate for responsible pain management. He advocates for more investment and research to be done by independent groups and not just pharmaceutical companies, and stresses above all that comprehensive education be mandatory for both prospective pain management patients and providers, believing that the consequences of failure to provide relief from chronic pain is inhuman and may cause even further physical damage in the long run. Both experts agree that chronic pain has the ability to alter lives and have spent their entire careers studying pain management. Each of our two experts approach their work from different aspects, but their combined research aims to alleviate pain, improve education for patients and providers, and ensure that chronic pain does not impact the physical health of sufferers any more than necessary. Thank you.